the co-chair of 2.0, which is an organization which is most famous for running events looking at the intersection of new technology and healthcare. And when we say new technology, I mean sort of post-enterprise software, software as a service, cloud, mobile, sensor-based tools that have been in healthcare. In the early 1990s, everyone was completely certain we were going to have managed care, and that managed care was going to lead to global capitation and big medical groups establishing, all looking like Kaiser. And none of that didn't happen for basically 20 years. Now we're back again with people saying the same kind of things, and I'm not sure. I think it's going to be a diversified pattern of providers for the next several years, but you will see strong growth in some interesting offshoots, such as more retail type clinics and companies trying to do branded provider plays, such as Walmart, Walgreens, and others that are going to try to establish a sort of beachhead for primary care. Then you're going to see more and more companies definitively providing worksite clinics, and those looking more and more like kind of old staff model HMOs, but with a modern twist. And those are companies like Facebook and Applied Materials work with a company called Crossover Health, which is doing that already. There's Boeing has worked with Iora Health in the past. You can imagine those kinds of organizations developing sort of primary care, a new world of primary care focused, sort of cheap concierge care, as it were, for employers, and effectively managing the care of their patients and employees outside the network, which is where the bad stuff is going to happen. And then the third area is, and the overlying question is, what happens to the mainstream big provider organizations that have spent the last 5 years consolidating and buying physician practices? And are they going to become, ACOs, which look more and more like a Kaiser? Or are they going to stay in the world of primarily looking for more expensive transaction-based fee-for-service care? And I just don't know the answer to that question. I think it's still an open question, and we'll probably still be arguing about it in 5 years' time. I always say I want to be able to email my doctor. So what we've been doing in the last, and I think personally, I don't think it's an innovation, but I would like to see a widespread adoption of the easy availability for patients to be able to access their data. And I mean easy. At the moment, I am on a little crusade wandering around to try to find data from myself and my family. I have 2 kids, a wife, and myself, and we have multiple different providers. And I'm always saying, okay, I want my data at the end of each visit. I want to try to find my kids' data. It's really hard, you have to jump through hoops and ask them to actually get access to where there is such a thing as a patient portal. You have to spend a lot of effort getting access to it. And when you do find the patient portal, it's got a very limited amount of your data in it. Whereas we already have things like Direct and Blue Button and other concepts which should allow us to download all of our data. And there are some people who do open notes and have access to all their information. And there are emerging companies who are trying to develop systems whereby they collect data from all different parts of the patient's experience together. People like CareSync, or the one I found yesterday, Patient Path. But it's very hard and very expensive. So I think the innovation I want to see is the easy access to all of health data for patients that can be brought together. And you can imagine from that, you could imagine all the services that can be brought together on top of that in terms of concierge care, care management, care advice.